question is, which organ is most affected in diabetes? Because there are so many organs that are being affected. There's no doubt that the heart is the one that is most affected. 80% of diabetics get a heart attack. Most of them die of heart attacks, sadly. So how do we prevent these heart attacks? The peculiar thing is, even if you control your sugars well, heart attacks do not reduce. You can reduce your eye complications, your kidney complications, but you cannot reduce the heart complications by simply controlling diabetes. So you need to look at the other risk factors that produce heart attacks, and these are mainly your cholesterol, your mental stress, lack of exercise, overweight, and smoking. So you have to control all this. What I would like to emphasize is on three things. Cholesterol. Cholesterol needs to be brought down to a very low level, which is usually not possible with just diet. So most diabetics need to take medicines to reduce cholesterol as well as to prevent blood clotting. So these two drugs are usually in extra to their routine medicines. The other thing is yoga for preventing stress, because we do not have anything in allopathy that can really prevent stress, and we have growing evidence that yoga, pranayama and meditation can actually de-stress us, not only at a mental level but also at a biochemical and cellular level.
What percentage level in India diabetes is increasing? Percentage level ఎలా increase అవుతుంది day by day? And which age group వాళ్ళకి ఎఫెక్ట్ అవుతుంది diabetes? పర్టికులర్గా ఈ ఏజ్ ఉంటుందా ఎవరికైనా diabetes వస్తుందా?
Diabetes is increasing tremendously in this country, and the World Health Organization has said that India will be the global capital of diabetes. How much has it increased? Most probably it has doubled in the last 20 years. Not only that, even more dangerous and alarming is that it is affecting people at a much younger age, and this is happening not only in India but in countries that are very health conscious like the United States, just because you have a lot of children that are becoming overweight. So this tells us that we should keep diet and weight well under control. The question is, what type of diet should a diabetic take to prevent heart attacks? Now this is in general what type of diet a diabetic should take. The most important thing is carbohydrates. We should consume unprocessed carbohydrates. The cause of diabetes and the worsening of diabetes is because of consuming large amount of processed carbohydrates, mainly polished rice. Now if you can take unpolished rice or whole wheat atta chapati, there is a lot of fiber in this carbohydrate that will not allow your sugar levels to bump up suddenly when you consume these diets. Not only that, more important than what you eat is how much you eat. Basically all of us consume much more than what is needed. So it has been stressed again and again that more important than what you eat is how much you eat. You have to eat lesser and keep your body weight at a perfect level. So how do we know that a diabetic has a heart problem? The most important thing is the risk factors. This is called universal precaution, which means if you have risk factors, you already have diabetes, you should control other risk factors like smoking, overweight, lack of exercise, high BP and high cholesterol. So that is one. The other thing is to actually know if there is anything going on in your blood vessels. A very nice test that has come up recently is a 64 slice CT coronary angiogram, which Narayan Hrudayalaya is offering along with the diabetic package for just 5,000 rupees. Now this will tell us if any cholesterol is actually getting deposited in the blood tubes supplying blood to the heart muscle, so that to know whether you're prone to heart attacks or